Which IBS type do I have for better management? Imagine trying to fix a puzzle without knowing what pieces you have. That's how managing irritable bowel syndrome can feel if you don't know your specific type. Knowing your IBS type helps you choose the right diet and treatment. Irritable bowel syndrome is a common digestive condition that affects how your intestines work. It causes symptoms like stomach pain, bloating, and changes in bowel habits. But not everyone experiences the same symptoms. That's why doctors categorize IBS into different types based on what your stool looks like during flare-ups. The first type is IBS with diarrhea. People with this type often have frequent loose or watery stools. They might feel a sudden urge to go and sometimes see mucus in their stool. Abdominal cramping usually happens before diarrhea hits. If you notice these patterns, you might have IBS with diarrhea. Next is IBS with constipation. This type involves hard, lumpy stools that are difficult to pass. You might feel like you haven't fully emptied your bowels even after going. These episodes can last 4 days and sometimes switch to normal or loose stools. If your bowel movements are infrequent and hard, this could be your IBS type. There is also IBS with mixed bowel habits. People with this type experience both diarrhea and constipation at different times. One day they might have loose stools, and the next, they struggle with constipation. If your symptoms fluctuate between these two, you likely have IBS with mixed bowel habits. Lastly, some people have IBS unclassified. Their symptoms don't fit neatly into the other categories. If your stool patterns are inconsistent or don't match typical descriptions, this might be your diagnosis. To figure out your IBS type, observe your stool consistency during symptoms. You can use tools like the Bristol Stool Chart, which shows different stool forms from hard lumps to watery diarrhea. Tracking your symptoms helps your doctor identify your type more accurately. Knowing your IBS type is key to managing it better. For IBS with diarrhea, avoiding foods that cause gas and reducing FODMAPs can help. Limiting caffeine and alcohol may also reduce episodes. For IBS with constipation, increasing fiber intake, drinking plenty of water, and exercising regularly can make a difference. If you have IBS with mixed bowel habits, a balanced approach with diet adjustments and targeted medications works best. No matter your type, managing stress and getting enough sleep are important. Some people find therapy helpful to handle the emotional impact of digestive issues. Remember, IBS does not cause inflammation or damage like colitis does, but symptoms can be just as uncomfortable. If symptoms overlap or worsen, seeing a healthcare provider is essential to rule out other conditions. In the end, understanding your IBS type helps you tailor your lifestyle and treatment plan. This personalized approach can make daily life more comfortable and improve your overall well-being.